Pemphigus vulgaris is an autoimmune disorder in which the antibodies are formed against desmoglein 3 and 1. The desmoglein is a cell adhesive molecule. In the epidermis of skin, the cells are connected with each other with the help of desmoglein. In Pemphigus vulgaris, the autoantibody destroys these desmoglein. As a result, there will be a loss of adhesiveness between the cell in the epidermis of skin. Due to the loss of this adhesiveness, the patient will present with blisters and bullae. The bullae of the Pemphigus vulgaris are thin wall which can easily rupture, and upon rupture it can produce erosion and ulcer, and along with that there will be a bleeding or oozing of blood from the blister site. These bullae, blister, erosion and ulcers of the Pemphigus vulgaris can involve any part of our body, but the most common site is trunk, which can spread to the limbs, but it can also involve the mucous membrane of mouth. The involvement of the mucous membrane is a characteristic feature of Pemphigus vulgaris, and it differentiates it from the bulla pemphigoid. And when the bulla erode, ulcerate, so after it will heal without the formation of scar. In this image, you guys can see the lesion of Pemphigus vulgaris. You guys can see the bulla. Here you can see the rupture bulla which form the ulcer and erosion. And here you guys can see the ulcer in mouth. These ulcer in mouth are the characteristic feature of Pemphigus vulgaris. Now come toward the diagnosis, that how we will diagnose a patient of Pemphigus vulgaris. For this we can perform two bedside tests. The first one is Nikolsky sign and the second one is Erber-Hansen sign or the bulla spread phenomena. Let's discuss the Nikolsky sign first. In Nikolsky sign we apply a tangential force on bulla. When we apply the tangential force, there will be a splitting away of a skin over the bulla. But the normal skin which surround the bulla, in the normal skin there will be also a splitting away of skin. This is called as Nikolsky sign. And the second one is the Erber-Hansen sign, mean when we apply a perpendicular force on bulla, the bulla will spread beyond its margin. For example, this is the bulla and this is the boundary of bulla. When we apply a perpendicular force, it will spread. This is called as Erber-Hansen sign. And both of these signs are evidence that there is a loss of cell-to-cell adhesion and the skin is flaccid. Other than these bedside tests, we can perform the immunofluorescence which will show the IgG and C3 deposit in epidermis, and we can perform biopsy. On biopsy, there will be acantholysis. Acantholysis means the loss of adhesion between the keratinocytes. The keratinocytes are specialized cells present in epidermis. So it was all about the diagnosis. Now come toward the treatment of Pemphigus vulgaris. To treat the Pemphigus vulgaris, we can use a high dose steroid. Remember that the high dose steroid such as a prednisolone in a dose of about 100 to 200 mg should be used daily. And when there is no new blister formation, the steroid should be tapered. And if there is a formation of a new blister during the treatment, we should increase the dose of steroid. But remember that we should give a maintenance therapy throughout the life. Apart from this steroid, we can use some immunomodulator and biological agent. So it was all about the Pemphigus vulgaris. If there is still any question, you guys can ask and stay tuned for more update.